Dr. Adam Rindy here, speaking briefly about intestinal permeability. The question always is for me, does the intestinal permeability come as a result of a disease process, or does it precede a disease process? I think there's some assumption in lay health circles that if you get intestinal permeability, that means that opens up you to these autoimmune diseases, when in fact we're not sure if the autoimmune disease started after leaky gut or intestinal permeability, or if the intestinal permeability and leaky gut came as a consequence of the autoimmune disease. So that's something very clear, that there's a confusion or a lack of understanding of which one's first. So there is clear data that there's an association of leaky gut with autoimmune disease. One of the models that we're looking at closely with this is rheumatoid arthritis. I just want to point out some research that shows some of the triggering factors of gut permeability issues according to research. So we see that there is an association of gut permeability with high fat diets, milk fat, some fatty acids such as lauric acid and capric acid, long chain fatty acids, even EPA, alpha linoleic acid, DHA, which a lot of these we use for health properties. Some of those fatty acids actually come from coconut oil and from fatty fish. So we may be aware that some dietary inclusion of excess amounts of these foods may lead to gut permeability issues. Also, gliadin is commonly known as a trigger for gut permeability. That's from gluten-containing grains. Alcohol is well known as a trigger for intestinal permeability. And we're looking closely at additives used in the food industry, such as emulsifiers, excess salts, surfactants. Then also extracts from vegetables that are used in processed foods. Chitosan is mentioned in this list, which is a component of the skeleton of shrimp or shellfish that actually is used in one health product, N-acetylglucosamine. So we also have to be aware of that. Factors that decrease intestinal permeability that we know of: certain forms of zinc, like zinc carnosine, certain levels of curcumin, which is from turmeric, polyphenols, such as the one that's most well known as quercetin, vitamin D, tryptophan, and glutamine. And we also know that there's certain probiotics that are being researched to decrease intestinal permeability. So we're not sure entirely right now about the gut association with, but we do know that there seems to be a lower diversity of certain species, lower counts of certain species in rheumatoid arthritic patients, low bifidobacterium species, low Bacteroides species, and low overall Provotella species, but an increase of this one bug called Provotella copri. This come back high in a lot of autoimmune patients when I do 16S rRNA sequencing for example. In my autoimmune patients, we'll see this critter come back elevated. According to these researchers, there's no known dietary influence on that of rheumatoid arthritis. We do know that there are the nutrients that I mentioned that lowering gut permeability and increasing certain bacteria. The most famous one is probiotic bacteria. The most famous one is E. coli Nissel 1917. We can't get right now, but that is shown to reduce intestinal permeability. These bifidobacterium species, butyrate producing species, but the one remains is, if we lower intestinal permeability, does that improve outcome for rheumatoid arthritis patients? So we're continuing to track this. Intestinal permeability is a area of research that there's a lot invested into right now to monitor and